Hi, this is Natural Health Radio. Dr. Teresa Dale here with you, and the fabulous Mark Alyn from Late Night Health Radio. We're here to give you a lot of great information about empowerment, your health, health freedom, how we can help you move to a better place in your life. So we really want you to stay tuned here. We're going to have some information about various health topics. And welcome, Mark.
Hey, thank you very much, Dr. Dale. Nice to see you again. You had a busy weekend.
I did, and it's a great thing to connect about because I really enjoyed myself at the American Naturopathic Medical Association. And I was lecturing there, and it was in Las Vegas, and 3 days, and it was awesome meeting wonderful health providers and people looking for to add new tools to their toolkit, doctors adding new opportunities for the patient. The most important thing in all of these things that I do for me is the end result, the patient. You know, so we have to reach the health providers in order to get that done, and that's what we do very effectively. So I was there with my team and a booth, and we had a great time, and I've been doing that show for many years. It's almost like homecoming. You get to know everybody that's there.
Medical doctors, MDs, traditional MDs, do they show up to this as well?
Dentists, medical doctors, chiropractors, naturopathic doctors, traditional naturopaths, clinical nutritionists, massage therapists. It's a beautiful group of people that...
if I had known, I would have come because I could use a massage. All the other stuff is okay, but anyway. Well, traditional doctors in most states need what they call CME.
Yeah,
right?
Continuing education,
yes.
Right?
And do naturopaths need that as well?
Yes. Everybody that is licensed needs that. And through the California College of Natural Medicine, depending upon the licensure, we do offer CMEs. So with medical doctors, they are open these days to changing quite a bit because their patients and people want natural medicine. They are looking for natural medicine. So people are driving this grassroots opportunity for everybody else. You know, whoever is ill, they want to find a natural way to do it.
What about integrative medicine? Do you think that's it's here now, but do you think that's the way to approach things?
I think it can be a good start. I feel that its awareness is growing, and the integrative part is, they're doing the traditional medicine with the natural medicine. And the only caveat that I see in that is that if they don't know enough about natural medicine, they could try it for a while at the patient's expense and say, oh, it's not working well enough, so we'll give you a drug. So with real natural medicine, that never happens. Never. It doesn't have to happen. You can do it all with natural medicine. So that's the only caveat that I see.
I'm choosing my words very carefully because I don't want you to yell at me.
Okay.
However, it is my experience that nothing works for everybody 100% of the time. Am I wrong?
Well, there is, it's an interesting thought, and I think that it's a good thought. However, in Europe and other places, in India and many other countries, natural medicine does work 100% of the time, always, unless it's an accident. I mean, if you're in an accident, you need help, you had a heart attack or stroke or whatever for emergency care, there's nothing better than our traditional medicine. That is where you need to go. But for degenerative medicine, if you're educated in Germany, if you're educated in Switzerland, if you work with people in understanding natural medicine and on that level, then you can do it all with natural medicine. You can give IVs of homeopathy. You can give There's so many different things that you can do.
But at the same time, doctors of all kinds, lose patience.
Doctors of all kinds lose patience, and the caveat there is that the patient may not follow directions, the patient or the problem was not diagnosed correctly. In other words, they didn't find out the real cause of the problem, and they're just treating their symptoms. Symptoms are not the problem.
Right,
That
and
is
we've
the key.
discussed that. But I was just asked this recently. Does something work for everybody? And it's
Not
like
the same thing.
Right.
Not the same thing. Not the same. If you're dealing with homeopathy and you have two people who have ear infections, both of them will, if it's on the right side of the body, belladonna would be good for both of them, but one person may need a different potency of it. Another person may need belladonna and something else. So you really have to be an expert to use natural medicine, and most importantly, to find the correct cause, not just the symptoms. What you see on a blood test is not the cause, it's the symptom. So as you're interviewing people in your job, and as we go through life, we meet people with all different kinds of ideas about health and things they've heard on the radio, things they've read in the newspaper or an article. It's very simple, okay? As soon as you have a symptom, you move it to natural medicine, to someone who understands homeopathy, and it's for 200 years. I mean, you could see results right away. You just have to do it, and you have to have a patient that follows directions.
Well, compliance for all is 50% at most, from what I've read. You tell a patient, do this, this, and this, and they may start that way, but most often they don't. And it's across the board. Massage therapists. I just interviewed a myofascial therapist who is terrific. I've interviewed medical doctors and even a witch doctor, and he said, you can lead a horse to water, you can't make the horse drink.
Right. The compliance is more than a 50% issue. Finding the right cause is 100% the issue. Because from that point, if the patient is not compliant, it doesn't matter if they don't have the right cause. And that's the kind of things we deal with every day, training doctors in all kinds of capacities, in all kinds of various businesses, whether it's in an outpatient clinic of a hospital or it's their own practice. What they need to do is first and foremost find the cause. So if someone said, the cause that the kidney is not functioning, that's not a cause. What is causing the kidney to not function correctly? And that is what we need to get the remedy for, whatever is causing. Because they'll know, it's the liver, it's this, it's that, but what is it about that? Is it a virus? Is it a bacteria? What is it, emotional issues that have been there for years, or is it a combination of all those things? Possibly even parasites. The thing that is the hardest to do, to get doctors to do, to want to do, to understand and have the tools in their hand, in their heart to do, is to go beyond the blood testing and find the cause. Go beyond the x-rays, go beyond the MRI, the CAT scan, find the cause. None of those things show you the cause. None of them. Having a tumor is not the cause. You have to find out what is happening in the body that the tumor developed. That is the key.
Now, last week you told us that part of that could be emotional. It could be the power of the mind. I'm sick, and so I manifest, if you will, a tumor. Am I wrong in that assessment?
No, not at all. But here's the situation: is you can pick that up from other people too. Somebody that you're married to, somebody that your family is saying, putting fear in you and saying, okay, you need to do this, you could die. The doctor says you could die. As soon as you believe that nonsense,
you're done.
That's it. Your immune system just drops and is so burdened, and then you have to work at getting that up, and that is working with the belief system, working with the emotions, and you need a health provider to tell you that you are going to get well, that you have the opportunity to become anything you want to do, and if you want to become well, that's what you can do. Now, if they go home to their significant other or to their family or wherever, and they don't support that, then you're back in the same situation. You need support. Every human being in a healthcare situation needs to be told that they're getting better. They need to be getting up in the morning and saying, I feel great. As soon as you say that, even if you didn't believe it, you just keep saying that in the morning when you get up, I feel great.
It's an affirmation.
And soon, it's a belief system, yes, and as soon as you say that a few times, then what's going to happen is you start feeling better. You're going to say, wow, I do feel better. You could do it right in bed in the morning.
Wow. Do you do that the first thing in the morning?
It depends. If I wake up, sometimes I do. It depends. I'm very happy when I wake up. I always feel good, like I woke up. I open my eyes. Oh, it's a good day. I mean, that's what I feel.
Well, it's
when I wake up.
Gosh, I get another day.
I do that normally without even thinking about it. But if you had it written next on your night table there, and when you get up, the first thing you see is I feel great, and you say it within yourself, I feel great, and you really mean it, and you say it, and in a moment you'll feel better, and throughout the day, if you just do those things. Listening to negativity or being in some environment where you're getting negativity, I see that as being a very huge part of a person's health problem. You don't need to go home or go to your parents or go to anybody who's going to be fearful and worried and say, okay, doctor says you can die. Well, excuse me, but SCREW, the doctor.
If you need to be spelled that, what about, you said listening to negativity, okay? And listening to negativity with
believing it, listening to it.
Well, listening to news. What about listening to the news? I mean,
well, that's the other thing. You need to have a mute. You have a mute button on the remote. You have a mute button on the remote. So that mute button on the remote is a very valuable button. That means when you see it starting to get negative and you see your heart start racing and you see that, oh my God, this and this and this is happening, mute it and go over to the Big Bang Theory and start laughing, because that's what you need to do. You need to really make a change. So the thing, yes, emotions. Now, this weekend I was with a couple who, the husband has a health issue, and the wife is extremely worried, really fearful, really on him all the time about, overly protective. And when I take him through and talk to him for 5 minutes, he stands up straighter, he smiles, the whole thing changes.
Maybe you should marry him.
Because well, no, but thank you.
I'm sorry.
So what I'm saying, and the whole thing changes because I'm giving him positive things.
Of course.
You have no idea how important that is. That is the key. And when a person gets supported at home in their relationship, they can heal, because every day they're hearing, you're getting better every day. You seem much better today. I can tell you're feeling better. Those are the kinds of things that you want to do with the people you love. Otherwise, why be in a relationship if you're not doing that or getting that?
What about general negativity? I mean, we hear this all the time. Husband and wife squabble about number one. How does he do that? I'm trying to think on Family Feud. The The question, they ask a question. What's the number one thing husband and wives fight about? It's money.
Yeah.
Right?
Right.
So they're arguing about money. Can that have money? They're talking about where to go on vacation. They're talking about what college their kids should be, and they're fighting about all this. What should we have for dinner? Spaghetti, meatballs. Oh, I don't want meatballs. I just want spaghetti. Whatever it might be. Can this affect one's health?
Yes. And they need
I was looking for a longer answer, but okay.
They should really understand that in a relationship, it's always give and take. And you can be expressive and say, I don't want this, I want this instead, whatever. But when it comes to talking about another person's ability to do something or to make money or to get better, it should be really positive. And that is what I see a lot of relationships don't have these days. And then I know a lot of them people have been married for 50 years. I know people 50 years and they're still in love and they're still happy.
I know people who've been married for 60 years and they're in love, but they fight like cats and dogs. And they say that adrenaline push is what's keeping them together and healthy and alive. But
their fighting is not like a serious thing, right?
I guess not.
Yeah, it can't be very serious. Otherwise, one of them would be dead.
You should look right now at Dr. Dale's eyes, the sparkle in her eyes as she said that. Seriously. Look. Right? It's just amazing.
It's funny. So the reality is, Mark, that when you should have some people on and interview them. Okay, you've been married for 60 years. What makes your marriage so great and you still be in love? And I doubt whether they would say, or anyone would say, it's because we fight all the time. I doubt whether they would say that, or they could say fighting leads to sex. And maybe that's
makeup sex.
Yeah, makeup sex. I mean, I don't think that's the right way to go about it, but whatever it takes to bring
for the individual,
for the couple, for happiness,
for the couple.
So I really believe that when you are in a relationship, that you need to really support each other in a positive way, as much as possible, and then everything can change. Whatever you think is wrong can change if people just try to do that.
I'm curious because you have some workshops. Coming
up, I have
right?
one October 14th and 15th.
Let's talk about that. What is happening in Orange County on October 14th and 15th?
Well, we're having the neuroendocrine and anti-aging regulation training, and it's a 2-day event. And if anyone is interested in learning neurophysical testing, a lot about homeopathy, new protocols for healing a variety of health conditions, and also about nutraceuticals that are clean, non-GMO, gluten-free, and really effective, then they should call our office to find out about that.
And this is for
doctors. Any kind of doctor. Any licensed health provider.
So even massage therapists.
Massage therapists, colon hydrotherapist.
And it goes on and on.
And on.
If you're a professional healthcare provider on any side of the street, you're welcome to come. What is the phone number or website they should go to?
The phone number, the website first, and then you'll find everything there, is www.cconm.com. And if you didn't get that, try this. It goes to the same place, www.traditionalnaturopathy.com. So we teach traditional naturopathy. We have online classes and we have residential or live events.
And this is one of the first that you're having?
No, this is one I've done for years.
Oh, okay. But it's the first one in the last few months.
Right. First one this year.
First one this year.
Right.
So that's cconm.com.
You got that down now.
I did.
You
cconm.com. California College of Natural Medicine.
Right, and then we also have, through the Wellness Center, we have the product education training, which is coming up October 21st, and that is free on a Saturday. So we really want to invite every health provider, and to that so that they can learn about the products and how they can work with autistic children, neurological issues, just so many different issues, cardiovascular issues. So when you come, we'll be talking about protocols. It's not just ingredient by ingredient talking about the products. I have protocols that I work with outpatient clinic, and I work with doctors to provide them protocols dealing with natural medicine.
This is the Natural Health Radio Show. I'm Mark Alyn.
I'm Dr. Teresa Dale.
And I was going to say that. And she's Dr. Teresa Dale, and we're here each and every week providing information about a wide variety of health topics. What are we going to talk about now?
Well, it's so very interesting that people are talking everywhere I go about the gut, leaky gut.
Oh, yeah, that's a big one right now.
Yeah, it's a huge one. And
I've got to ask a question because I've never asked this one before.
Okay.
Does that mean my gut literally leaks?
Yes, it's like it's.
Ooh.
You actually have a leaky gut where the body becomes toxified. And one of the things that people do is they can take colostrum and all of these different things, but that certain things, if it comes from cows or dairy or goat milk, if you take any probiotics made from those, that's actually an inflammatory. So you have to be very careful how you handle leaky gut, and this causes a lot of course, digestive issues, bowel issues, various issues, even pain. So leaky gut is dealt with best by using some homeopathic medicine and some very mild herbs to heal the entire digestive system. But the most important thing, no one is really doing it as much, or because it's difficult to make a product for it, and that's a biofilm. If you don't get the biofilm cleansed out of your body, you're going to be dealing with leaky gut for years. So the biofilm is from the pathogens. Pathogens secrete it, and it becomes like
and that's the leak.
No, and so it becomes like a cloaking device.
Okay.
In Star Trek.
Yeah.
So the biofilm protects the pathogens, so you can't kill them with drugs. I mean, they're going to laugh.
Or the phasers.
Right. They're going to laugh at colostrum. You've got to move the biofilm out and work with inflammation.
Recent studies indicate, and both allopathic, traditional doctors, and alternative health practitioners are all agreeing that good health begins in the gut.
It does. Happiness begins in the gut. It really does. Your emotions related to leaky gut, the small intestines, if we want to start there, is feeling overly vulnerable. If you are overly vulnerable and very sensitive to things, then that is related to the small intestines. Too much vulnerable is good, but overly vulnerable, you become a victim emotionally, and you create that scenario. And then the gut itself, the colon itself, is stuck. So if you're stuck about anything in your life, it's going to reside in your colon. It's going to make a health problem there. According to the 5-element theory of Chinese medicine, this is what every doctor should be using today in considering what is the cause of the problem. You can use that as a tool. So of course acupuncturists use it as a tool, and naturopaths usually use it as a tool.
The other thing is that there are significant increases of colon cancer. Now, one is because we have more people, but beyond that, is that because everybody holds it in and the gut is kind of like the real heart of the body?
Well, it's not the only reason. It's a component possibly for that condition, colon cancer, but it's also meds, drugs, bad food, junk food, fried food, problems with eating, with emotions. It's a number of things and medications that we are not like plumbing where, doctors will say, oh, it goes in and then out. No. It goes in and it gets stored in the fascia, in the tissue of the body. It can cross the blood-brain barrier and go to the brain. So we need to stay focused, and this show, Natural Health Radio, is about staying focused on our health, freedom to make new choices, different choices than we've ever made before. And if you already love natural medicine and use it, great. If you don't, well, something wonderful is waiting for you.
You mentioned fascia, and I just did an interview, I've done several now, on myofascial release. And I was talking to a practitioner in the San Fernando Valley. Her name is Seppi, S-E-P-I. And Seppi explained that when she went to physical therapy school, that the instructors showed everybody the fascia throughout the body. It's a coating, right? Mm-hmm. You pulled it away, and nobody knew what it was until they didn't realize that it could
adhere. It can adhere.
Well, it holds emotions for one,
right?
But they were taught to pull it away, and that wasn't important. Now, and for 17 years, Seppi has only worked on releasing fascia so that the body can heal itself.
Well, I think one of the best ways to do that is through Rolfing. And Rolfing, it was developed by Ida Rolf.
Right.
And I've had 48 treatments of Rolfing. I used to have scoliosis seriously, and I used to have a lot of other joint problems. And so I haven't had a session for many years, but there was a period of 5 years that I went through with the scoliosis, a curved spine, where Rolfing saved that and made it completely better, and I don't have it anymore, and that's dealing with the fascia. And I think that is one of the best things that you can ever do for your body, but you need to find a very experienced practitioner working with Rolfing.
Right, and or the MFR. Have you had that?
Yes.
It's tremendous. She's been practicing for 17 years, and it's really truly amazing. I felt like a wet noodle.
Oh, well, that's good. That's always positive.
When I left the session, in looking at the overall body and concentrating on the gut, you mentioned good food, clean food. So taking care of our colon, our stomach, esophagus is a beginning to maintaining good health.
And also not eating so much red meat that it's very difficult to digest. Don't forget, if you don't move your bowels, then the meat sits in your colon and it putrefies along with everything else, and it's much worse than if you're constipated.
Right.
Think about it. So,
I knew somebody, this is going to be disgusting, so hold on, boys and girls. He hadn't moved his bowels in over a month. I mean, and ate poorly, mm-hmm. and literally his colon exploded, and he died.
Well, the thing is that there is such a thing that we could be trained in and talked. Somebody could actually tell us, like when we go to a doctor, that if you're having colon problems, to go to a colon hydrotherapist to save your life. I totally believe in colon hydrotherapy. I mean,
I had a session last year.
Good. Yeah. Well, it's possible that you need 12 more,
What, do you get them that often?
Well, no, but I'm saying if you only had one in your life.
Oh, I've had several.
Okay.
I've had many.
Okay, good.
But my last one was maybe last year sometime.
Okay, so I think that once a year, just to keep things going, you should have 3 to 6 colonics, right? And one will just sometimes hydrate a person because they don't drink enough water. So you don't oftentimes in one get everything that you need to get out. Now, I'll tell you, interesting thing is when you have toxins and food and things and putrefaction in your colon, and it can move around the colon, and you could have stuff all the way stuck on the right side. I call it, you can have stuff there from the dinosaur years. In other words, you could have stuff there from 10 years ago because you have pockets in the colon. So dealing with the colon, you have to understand that you're not doing it to go to the bathroom, that you're actually doing it to actually heal yourself. So I have seen that people heal many different conditions, serious conditions, doing colon hydrotherapy.
No, absolutely. I have seen it as well. And I find it relaxing. I guess everything I find is relaxing.
Except, when we walked in today, you weren't too relaxed, but now you're very relaxed. And we have to understand, too, that the colon hydrotherapy is part of a detoxification process. So if you wanted to take herbs, the detox kit that I have, that I work with patients and doctors with, that would be wonderful. That is the best way to go. And then, wait maybe a week after starting it, and then start a few colonics to help pull the toxins out even more effectively. Don't forget, you're pulling toxins out of your blood, you're pulling toxins out of all of your organs, and it's all going into your colon.
Out of your cells.
Out of your cells, also out of your organs. Mostly the organs are going to come first. Everywhere you're going to get, including you could get it out of your brain, you could get the toxins from everywhere in your body, from the fascia, from the tissues of your body, muscles, everywhere. But then you could have all of this stuff in your colon because you're not moving your bowels as regularly as you would like. Maybe twice a day would be the best thing. Now, and then a colonic would really help that process a whole lot.
And it's not uncomfortable.
I don't feel like it's uncomfortable. I can't, I don't think anybody's ever said, oh, I really like, going through it. What they say is, I really like how I feel afterwards.
Yes.
It helps me. Afterwards, I had no symptoms. Afterwards, the headache went away, this pain went away. Afterwards, my knees, I could get in my shoes again, and the swelling in my legs were gone.
Wow.
Because it helps the lymph, and it's going to get all of that fluid and everything out. So I think that it's one of the best things a person could do. Doing the detox, and then also doing colonics would be the way to go for any health condition. And if you're not doing all those medications that you're taking is getting stuck in all of your organs.
What about, I'm trying to think of another word and I can't, so enemas. Is that the same thing as a colonic?
No, and that's a good question. A lot of people say, oh, well, I take enemas all the time. Well, if you had some colonics, you wouldn't need enemas all the time. The enema just does a superficial wash of the descending colon on one side. It can't go completely around the body, around the
because
tummy.
There's not enough pressure.
There's not
or
enough
water.
pressure. But the right way to do a colonic is to do it with a machine that hydrates and doesn't use hard pressure. You don't want a lot of pressure.
No.
You want a tiny bit of pressure, and a good colonic therapist, and most of them are terrific, very well and skilled and trained, you will get what you need. So talking about leaky gut, as we started today, doing colonics would help you tremendously.
Is that, by the way, is that water that's put in?
Of course.
And just water?
It's triple purified, usually reverse osmosis, triple purified water.
And it's just water, there are no minerals or anything else in there?
No, but in certain states it's legal to do ozone in the colonic, and if you have cancer, the best colonic to get is one where the practitioner will put ozone in the water, to ozonate the water, because ozone kills cancer. So
because oxygen kills cancer.
yeah.
Right?
So ozone is one of the most magical, amazing things to either, if you want to drink a glass of water with ozone in it, or you want to go to a colon hydrotherapist that uses ozone in the colonic water. Some people put wheatgrass. They do a wheatgrass plant with an enema. Some people do coffee. I don't like coffee enemas because it's too stimulating for the adrenal glands. Don't forget, what you put up in your colon goes everywhere. Yes,
sure.
Because of the caffeine.
Is it absorbed into the wall of the colon?
Yep, absolutely.
Gotcha. This is Natural Health Radio. I'm Mark Alyn. We're talking with, as we do each and every week, Dr. Teresa Dale. And there are two events happening, one for professionals and one for everybody, even Daryl and I can come. And that is happening in Orange County, California. And we invite you to go to cconm.com. cconm.com for the professional 2-day seminar that's
It's the
coming
neuroendocrine and anti-aging regulation training. And that training is October 14th and 15th. And then the free product training would be on October 21st. They're both in Orange County.
Orange County, California, because
Yes.
there's one in there's New Jersey.
Oh, that's right.
And there's one in Florida. And there's probably one someplace else too.
Right.
So
anyway, Orange County, California, and what we want to do is to make sure that when you have an opportunity like this, that you take advantage of it, and go to our website for the free product training October 21st and register there. Go to wellnesscenter.net, go to events, and then register for the October 21st product training. And what you'll be doing is learning about protocols for healing different things, being able to ask questions. And we are looking at, right now, we're looking at recording that. So, and possibly even a video so that we have it for the future. So come on in. We'd love to have you and help you in any way that we can. I think that in Natural Health Radio, a lot of people have really liked what we've been doing. And I think the whole thing about health freedom is the thing that people really need. They want to be empowered to make different choices. So we want to talk about what's right, what's positive, what we can do. And by doing that, it gives people an idea of how to navigate a health situation. So what they ask me is, okay, my husband or my wife has this problem. What do I do? What's the first thing I do? Well, what you do is you get the blood test. You need them to see what the symptoms are related to. But then you find somebody who can get you and determine the cause of the problem. What is the cause of the problem? Could be mercury fillings in the mouth, could be a root canal, could be an implant. And they are
that's dental. What about
a dental implant?
What about a breast implant?
That will, if it's silicone, then it's very, very bad. Sometimes they just put
leak.
water in them. They put saline solution.
Those
which
are
is
the
salt
newer
water.
ones. That's the newer ones.
Yeah, but the older ones do leak. And even more importantly, what people are not told is that the envelope of the breast implant has platinum, so platinum can get into the system very easy. Platinum is great on your fingers and jewelry, but it's a neurotoxin. Platinum.
Wow.
You can look that up. You don't want that in your mouth, in your teeth. You don't want that in your body. Platinum is in the envelope of the breast implant.
Is that an element we need?
No.
We need traces of copper.
Well, traces of copper and zinc are in food or in different things in the earth. Platinum is not something that we need.
That's
but more
mine,
importantly, what I'm trying to say to you is it's a toxin. And we really need to be careful about having platinum in our teeth. People say, dentists will say, oh, this is great, we're going to mix that. They never give you gold fillings. There's no such thing as just gold.
Right.
It's always mixed with platinum or palladium or, some other tin or copper or things, but the platinum and the palladium is one of the worst, and the nickel, if they'll mix it with nickel. So the gold is never just gold. It's an amalgam.
Well, gold is soft as
so,
a metal.
So the amalgam has to be in there, but they could use something like a pure silver without nickel. They could use something else, but most of the time they buy the platinum and the palladium because they're harder. So as far as fillings, I would never recommend a gold filling for that purpose, but you could get a porcelain or a ceramic is good, but porcelain's better. So I would.
I know that in the last 10 years or so, gold teeth are fashion statements, not to me.
Yeah, I don't think it's a fashion statement. I don't know where they think of it that way,
but they do.
Yeah, so I would really be very concerned about anyone putting any filling in your mouth that is made from a metal. You don't want a metal filling. You want a non-metal filling.
I'm just
a porcelain filling is the best.
A porcelain filling is best. Something just popped into my mind, and you know how your mind is. My mind kind of wanders there. What about tattoos? I mean, because the guys who have the gold teeth
have the tattoos.
Yes, ma'am.
Well, the thing is here that the tattoos are interfering with the acupuncture meridians on your body because of the scarring that is there, the actual process of doing the tattoo, plus any heavy metals that are in the inks. So I think they're very toxic, and I think all of those things are toxic. So we need to take a look at that. We need to think about it before we do it. What we should do is go online on Google. People do that for every other reason. They could go look at any side effects and what kind of metals are used at the when you go in to get a tattoo.
When I was on an airplane yesterday, they were offering children removable tattoos. They were watercolor tattoos. I think they said they were made from
vegetables.
Vegetable stuff.
Vegetable dye.
And I thought, oh, that's kind of cool. But if there's a needle or a pin in it, there's no way Mark is going to have a tattoo. Raise your hand if you have a tattoo in this room.
Nope.
I
no
don't
tattoo.
have one. I raised my hand. Why did I do that? I don't even have a hidden one.
Well, so tattoos, you don't even have a hidden one, huh? Well,
no.
I don't either. And I think that before you do anything like that, I mean, I know it may be cute, but realize you're stuck with it forever. Forever you're going to have this tattoo unless it's removed by laser. They have different ways. And that hurts like anything, little puppy. It really hurts.
I did a video on laser removal of tattoos. Mm-hmm. Oh my! And the models, right, are smiling, and you can see
they're sedated, Mark. They're sedated.
No, they weren't sedated, but they were grimacing.
Well, they were on some kind of opiate thing.
They had to.
It's hard to do that because it hurts so much that they're and they can use local anesthetic and different things. They could do something like that, but it really hurts to have that removed. So the best thing is to think about that before you do it.
So you're 24 years old, all right, and you're walking by a tattoo parlor and you see this cute little, and let's say you're a woman, it doesn't matter. You think I'm gonna put Herbie on my tush, whatever it might be. First of all, why would you show your tush to a stranger?
Right.
That's one. I'm sorry.
And the other reason is, why would you like Herbie?
Yeah.
I mean, what's wrong? What's going on with Herbie?
Yeah, exactly. In 2 weeks, you're gonna like Dickie, and so but now you're 24. 20 years later, the shape of your tush probably has changed.
And Herbie's going to be sagging.
Yes.
Yeah,
nothing worse than a sagging
Herbie.
That was my joke.
Well, here's the thing that we love to do is to help people make new choices. And before you do anything that permanently affects your body, try something with your hair. Do something different with your hair. If you're going to do anything, not a permanent thing that you're going to have for the rest of your life.
Well, have you put personal question, but have you put green or pink or
No.
purple in your hair?
Nope. I'm busy.
You're busy.
I'm helping save lives. I don't have, it's not going to help. If it was helping, if it was like I was only working with children and they needed to have some kind of attention, they would like that or whatever, I might do it for a day, but I've never done anything like that.
No.
I think ear piercing. I wish I didn't get my ears pierced, because the hole where I put my, earring, the
Right.
pierced earring, is related to my vision, is related to my eyes.
What if you take the stud out, the earring out, want to grow
It has
back?
to heal up, and sometimes they don't heal up that quickly.
Got it. How long? But you must have been a little girl when you had your ears pierced.
No, I was 20 something.
You're a little girl when you
Yeah.
had your ears pierced. Yeah, I don't. I never thought about that. And in the 70s and 80s, men were doing that.
Men were doing that. Now they're doing that to their nose rings, nipple
I don't
rings.
get
They're
it.
doing belly rings. They're doing rings everywhere. Tongue rings. They're
That's
doing
very dangerous.
all of those places too.
Oh, yes.
The twiddler over
The
here.
twiddler showed us some genitalia
twiddling.
Can I tell a quick story? So somebody I know was singing, recording an album, and then she got sick and the doctor said, you can't go into the studio for 6 weeks or 2 months. She got bored, and she was passing a tattoo place and went in and had a tongue piercing, which I think, I can't imagine the pain. But beyond that, what I've read is that your tongue could swell and you could
And you
suffocate.
can't sing.
And you can't sing. So now she's back in the studio, and I'm doing this on purpose. While she's singing, there's a click, 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 click. And the engineer's going nuts. He can't figure out. And he sends her home because he can't figure out where this clicking is coming from.
And it was from the piercing in her tongue.
Yeah, and she didn't say anything. So she took it out, I guess, and
Had no more clicking.
there was no more clicking.
Well,
Anyway.
the thing is that now in acupuncture they use little gold studs or surgical stainless steel studs that they have magnets in, and you put them on certain points on your ear. Because there is such a thing as auricular therapy that I studied, Noget auricular therapy. So you can heal the whole body and the spine and everything through your ears. And there's points.
Is that why at the end
But
of a massage?
it's not a piercing. It's not a piercing. It's
Right.
just a little magnet that you put there.
They at the massage
massage your
therapists, they
ears.
massage the earlobe. It feels so good.
Yeah, it does. So if you've never massaged your ears, you can do it yourself and do the whole edge of the ear all the way around, because it massages all of the organs in a positive way. Think good thoughts when you do it. Think about healing your body. You can do so much. The other thing I'd like to talk about, maybe we can do it next time, is about Qigong, medical Qigong, and
Oh, yeah.
and how effective that is for the body, because I really want you all to learn things that are going to help you. And Qigong is something you could take a class in. You could learn medical Qigong and how to take that Qi and put it into your liver, your kidneys, your body. So there's so many things to learn, and I can't wait to share that with you. So I think one of the last things that I'd like to do is just to once more tell you about the October 14th and 15th training, and it is for neuroendocrine anti-aging regulation, and that is for licensed health providers only. But then I have a free product training October 21st that Daryl and Mark could come to, and anytime. So, and that is to talk with you about products, to talk with you about protocols for healing, and give you actual protocols using natural medicine 100%. So, we want to, Mark, anything else that you want to share?
No, I look forward to seeing you again next week.
And we will have another great time and helping people for all the right reasons. There's all the right reasons whenever you come to Natural Health Radio. You're going to get a lot of good information. We're both here, our hearts are in it, and we're ready to help. So I want to thank you so very much. And Daryl, are we almost done? Or what time?
We are darn near done. We got about 30 seconds to wrap it up.
Okay. So we want to thank you again. Thanks, Mark.
Thank you, Dr. Dale.
Thank you so much. We'll see you next week. Many blessings at Natural Health Radio. So we'll see you next week.